Why did you detransition,
Yeah.
right?
After top surgery, not really. I mean, the problem of I have breasts was gone, but also at the end of that, I was also thinking, well, I didn't really need to do that because they were already somewhat deformed anyways, and I still don't like the way that I look, and I still feel uncomfortable. So that didn't really resolve, but at the time I was sort of done transitioning. So I was in this place of like, I don't really know where to go next, and things are just getting worse, and it just kept getting worse. I had sort of started opening up and realizing I needed to deal with a lot of the sexual trauma that I had.
Okay, opening up to who?
I had talked a little bit to my parents about it and sort of just came to terms with it in my own head.
Okay, so you'd revealed some of it to them?
Yes.
How did they react?
Vaguely. I revealed some of it, and they were very, very concerned and very distressed. And I think they immediately sort of questioned why I was in gender therapy, and they immediately wanted to put me in treatment for sexual assault only. The therapy that I was doing was so surface level and wasn't actually addressing any issues in my mind. It was just creating more issues and giving
Why did you come to that conclusion?
Because they kept affirming that I was somehow intrinsically male and that would solve all my problems. And then once I matched the outward appearance of a male and I didn't feel better, they had no answers for me. That therapist barely spoke about my gender. We didn't even discuss it. Maybe once. We've talked about it maybe once. We went over it and I said, yeah, I've been trans-identified. And then we just sort of only really dealt with my childhood trauma, my sexual assault.
How was your new therapist trained? What was their specialty?
DBT and CBT were their therapies.
PhD psychologist?
Yes.
Do you know where they were trained?
I'm not sure.
Okay, fine. But PhD psychologist.
PhD psychologist.
Okay. And it was a more behavior therapy oriented approach. Okay, so, and what did they do with you?
We went through dialectical behavioral therapy, and then I also did something called imaginal exposure therapy, which sort of helped me remember a lot of the gaps that I didn't actually have filled in. And then once we did that, we just did a lot of general talk therapy.
Okay, why do you think that? What did you talk about that you think was helpful?
The number one thing that I think was helpful that we talked about is how that experience from childhood made me think about what it meant to be female and what external
And what did you conclude?
I concluded that I had been attributing a lot of self-hatred to femaleness.
Yeah.
I had been putting a lot of my own experiences onto femaleness as a whole, and I had been taking that out of myself for a very long time.